Namaskar and welcome to FAQ on India Friends. I'm Vidhi Kumar. And as we speak, friends, India has vaccinated over 18.25 crores of its billion plus population. And today in FAQ, we are joined with an expert to talk about the COVID crisis, Dr. J.A. Jayalal, National President, IMA, and Professor of Surgery. He's also Vice President, Commonwealth Medical Association, and National Coordinator, Indian Medical Association. Many thanks for joining us today, sir. Thank you so much for joining us, sir.
Thank you very much, Nidhi. Nice to meet you and participate in this program.
Thank you so much, sir. Meanwhile, sir, my first question to you would be, how do you think India is faring now? And we are often hearing about the third wave. Since you are the president of the Indian Medical Association, I'd like you to share your views, sir, on what you feel is now happening. Luckily, the peak is plateauing in a few states.
Yeah, it is as predicted and as expected. Now, in 18 states, we are getting the plateau of the cases. That means the cases are very much reducing. But there's still the positivity rate is a little high in some of these states. And other few states, the cases have been rising. So we are now, in our medical term, we are not yet out of critical condition. We are still in the critical situation. But they hope we are getting that some of the states where we are able to do plateauing of the case, it also gives us a confidence that we will be able to face this disease with much more confidence and much more effort. We will be able to overcome this. As natural to any pandemic, and it is inevitable, we will also have the third wave. We will not be able to exactly predict and how it is going to be, then when it is going to be. But by the way in which what we had previously experienced, either in the Spanish flu and other pandemics, definitely there will be change in the demographic pattern, how it is going to affect, and it will be definitely going to come. And it is a time for us to get prepared and ready to be face the challenges we are going to get in the third wave also.
If you look at the challenges that we have faced in the second wave, there have been quite a few. And I must congratulate you there at Maharashtra for an excellent job as far as both first wave and the second wave are concerned. Somehow the government has brought it under control. Could you tell us how things have played out and what are the factors involved and how you have been monitoring the second wave at Maharashtra, sir?
I must compliment all the stakeholders in this mission, both the government, the medical fraternity, and also the media people who has built that awareness, and also to the maximum extent the public also. The first and foremost, I must appreciate the government for implementing night curfew and systematic lockdown, which has definitely helped us into curtailing the transmission of the disease as the movement of the people were reduced. And that is one of the greatest help, because right from the beginning, on the day one, the government has implemented that. Second, the most important thing what has happened there is the COVID task force, which has constituted with the help of the practicing doctors. They do not check that only the government doctor has to be there, but it was Dr. Shashank Joshi and his team who were actively practicing the management of the COVID people. They were included in the COVID task force committee, and those advice, their on the field advice they were able to give was well accepted by the government, and it's implemented in appropriate time. And there was a single level focus attention was done there, not instead of too many people. I mean, the concept was changed. It is both the private and public health sectors work together, and that was the greatest achievement what this Maharashtra state could see. If you see the Dharavi incident, it was again public-private partnership. Indian Medical Association and the government doctors actively participated. Test, trace, and tracking the people were done effectively, and thereby we were able to overcome the disease. And see the congestion, the amount of population density at the Dharavi, and it would have been a disaster. But for the intervention of the government, taking help of all the people, and that is a good leadership. I could see that everyone was involved. Everyone feel that it is their responsibility. Everyone were able to participate with a lot of hope and enthusiasm. So that has helped us in definitely controlling the disease in Maharashtra. So I compliment all the people, both the government, both central and state government, and the stakeholders for effectively doing that. Still they struggle. I mean, I'm sure that they are not yet over the crisis, but still they struggle. But to the maximum extent, they have plateaued the number of cases happening there.
So what about facilities like remdesivir injection and oxygen? Why have people been really running after? And if we speak about Maharashtra, do you think things are under control now? Do you think there are enough beds for patients? What are the other challenges that you foresee? To begin with in Maharashtra, and then I'll come to the other states.
At present, the number of cases which are coming in is less. So that with that we already, when the cases are coming up to the level of 60,000 to 65,000 per day, and even that level, the hospitals were able to take care of the situation. So now with a limited number of cases coming in, definitely the situation has much eased up. I had a discussion with many of the doctors in Maharashtra yesterday. We had a Zoom meeting and realizing the fact, and everyone feel that now the remdesivir is becoming available to them, and there is not much of difficulty, and oxygen beds capacity is also increasing. The people are able to get the bed, especially in Pune, where there was a lot of congestion in the beginning, and now even including Pune and Nagpur, there is a much better involvement is there. And now the government is also trying level by the second level of vaccination also. They are opening up the centers, and they are trying to make, though there is an apparently stop the vaccination for the under 18 till they get an adequate vaccination. But I think they are well prepared to face that situation, and they will be able to overcome the condition at this moment.
So do you think at some point of time people have become self-medicators and they started taking ivermectin and omnacartil and these steroids off the shelves? How safe is this? Could you extrapolate?
No, absolutely not safe. It is one of the commonest profession. Everyone does in this world is a medical profession. Everyone become doctor at their time of need, because they were little afraid to come to the hospital or get appropriate treatment consultation. So whatever is coming in Google or whatever is coming in other medias, they were adapting to that. The rampant use of steroid, the rampant use of the ivermectin, other drugs, which has been suggested by the various medias, were taken by the people without taking adequate care. And definitely there was no absolute need for them to get fear and take all this medicine. This will lead on to most post-COVID complications in the people. It is one of the difficult area where we need to contain it. So only that can be done by building up the social awareness and public confidence on the government and public confidence on the medical system which is available, and very strict curfew on the people who are spreading false messages, and the WhatsApp university should be curtailed to spread the false notions and false messages. So our appeal to the people: do not fall prey to such anticipating such. Taking drugs without the prescription, and do not take drugs in fear. And if you have a problem, now the facilities open up. Come and get a consultation. Government of India, like Atal Innovative Mission and Indian Medical Association joining hand and starting the telemedicine concept. So anyone can get the opinion through the telemedicine and get clear up their doubts.
Absolutely, but as it spreads to rural India in many parts of the country, sir, there has been a rise of black fungus or mucormycetes, as it is called in the medical terms, because of over usage of steroids, and also because this happens mainly in the recovery period. So I hear from after COVID. So can you please tell us a little more on this, sir?
Yes, this mycorrhizasis is an opportunistic infection, especially if people who are immunocompromised will get this infection. See, what happens when the people are diabetic, they are severe diabetic, they come to the big hospitals, they are in a crowded situation. In fear of COVID, they get a steroid. They forget to take care of their diabetic. So under the diabetic, steroid will also augment the glycemic conduct in the body, so that people will go for a severe hyperglycemia state, and that is a good fertile field for all these fungus to grow. There is a one reason where it is may not be exactly the steroid is causing, but steroid indirectly producing hyperglycemia, that is placing a fertile field. And the second commonest problem we get is an oxygen. When we are giving oxygen, it has to go through the bottle for humidification. We send the water, it pass through the water, get humidified, and then it comes to the nostril. When this water is not changed adequately or frequently, or when the water is not contaminated, it also plays a major role to make the fungus to grow. So that both these conditions, the environmental condition, the host immunocompromised situation, the hyperglycemic fertile field, all this leads to the combination, leads to the development of the fungus to grow in the body. That is a little dangerous condition if we are not able to note out in the early part. definitely it can end up in even the fatality it can go lead on to. So now this information is passed on to most of our doctors. They are much aware of that. They are taking care on that. Every patient, when they are coming in, we are checking their diabetic status, and accordingly, the measures of control of diabetic is also taking place. The steroid use has been reduced judiciously, and the environment, or the how we are giving the oxygen, the humidification of the oxygen, yes, water is changed daily, and fresh antiseptic water is used. So all these will definitely bring down the mucormycosis. Though we have some 1 or 2% incidence of the cases, I am confident now the medical community is coming into the terms with that, understand the situation, and definitely take more care so that we will be able to reduction in the number of cases which are reporting with the mucormycosis in the days to come.
Yes, sir. So far, so good. We're gearing up for dealing with black fungus, as you said, by taking more care of oxygen and other things that are administered. Now, my question is, sir, if we talk about the mutation, the B1.1617 and the B1.117, there are several mutations that have been seen in the Maharashtra COVID variant. Would you like to tell us a little more on this, sir, and our audience?
Yes, this SARS-CoV virus is a RNA virus. It is a mutation is inevitable. If the RNA virus is not mutating, then that is only the news. So it is naturally the virus will go for mutation. There are nearly 3,500 more mutation has been reported from the virus. There are few mutation which is happening in anticipating the hostile environment. This virus makes some changes in the body so that they can still survive and able to produce the disease. Is the two, one of the most important is, as you rightly said, B1617 and 11767, and both these are seems to be spreading fast. They have the capacity to infect more. The transmissible rate of that is much more higher than what we had the original Wuhan virus. So this, but unfortunately, the problem we face is how do we identify this? We identify this by doing the genome sequencing test. But in the early part of the day, in the last September and October, the number of cases which we are doing genome sequencing is relatively less. So we were not able to anticipate what exactly type of the mutation which is happening. So now there is much more studies happening, and more research is going on. Now we are able to pinpoint, and these are the type of vaccination, the mutation which is taking place. And fortunately for us, what the studies has shown that the vaccine which we are using is potent enough to curtail this mutation also. So that is so this mutation, but for the transmissibility it has caused, it is not having a much more impact. Definitely the treatment modality or the vaccination prevail is the same going to be there. But we are more feared about how it is going to be there on the third wave. If now if the genome sequencing, if we are doing it adequately now, and that will definitely help us to identify what type of genome changes are taking place, what type of virus will be there for the third sequence of third wave. And also one more incident which we also need to study is, suppose a person who has already vaccinated is getting the infection again, then again we need to do the genome sequencing study, is there is any mutation has taking place in his body. So as on date, and nothing much to fear on this, it is under control. Still, it is under the therapeutic compulsion, therapeutic way in which we can control the mutation. But our eyes should be open, and the testings of genome sequencing should be more, so that to get prepared for the third wave, which we are going to get in the near future.
Sir, before we go on to the third wave, my next question to you is, how would you like to explain transmissibility to a layman? Like we often hear statements like it is airborne. So that means anybody going on the road can, intake this kind of virus just by the sheer presence of it being in the air. How would you justify this, sir?
Absolutely, the report which has come in Lancet is, if you read it very carefully, it was saying that in a hospital setup, if my consultation OP is a closed door with a 20 into 20 size, there is no adequate ventilation, there is adequate air passage is there, definitely the virus will be still floating in that air. But it cannot be naturally when the person is just traveling in a car or traveling in a bus, it will not just float in the air. See, the virus, what is the difference between the droplet infection and the airborne infection? If I am putting a ball from my hand, if the ball is light, it will go for 3 meters or 4 meters and fall down. If the object which I have is a weight object, if it is iron material, it will fall immediately. The same principle is there. Here the weight of the virus is more than 5 micron and which cannot float in the air unless you have a big wind or somebody is sneezing. When he sneezes, it can go up to the 6 meter. When he cough very violent cough, it can go up to 6 meter. Otherwise, it will be just fall nearby. It cannot float in the air. So in a room, in a hospital setup where everything is closed, there is the ventilation is not good, or in a house when you are living, your house aeration is not good. You are always closing the window and there is nothing is opening. Your AC is just throwing the air inside and it is not producing the exhaust. Then the possibility with the air circulation, this will try to circulate again and again inside that component. It will never go in the street and it will never go in the world environment where it will be float. So nothing much to be worried. See what we are going to do, whether it is a droplet infection, whether it is a airborne infection, the only way is to wear the mask. And if you are wearing the mask, whether the virus is coming and floating and coming and hitting you, or just in the person who is standing in front of you is throwing the virus on you, both you can be prevented by the mask you are using. So I'm not worried much whether it is, you talk the term in aerosol spread. But as far as today, the medical fraternity, we do not give much importance to the concept which has come in the Lancet, which is airborne, which is a misinterpreted one. Still, it is the droplet infection is the 99% source of infection, and masking is the only solution we have to prevent from that.
Sir, would you like to also add and tell us why this virus is, hitting people in the age group between 30 to 48 years, which is now the pattern in the second wave, and how is it affecting their lungs? If you'd like to tell our viewers that as well.
No, how do you get somebody else? Only when you are confident with them. And who are the people who moves around, travel from one place to other place? It is only the people from 30 to 55 age group. If you are above 65, your house will not allow you to come out. They will hold you inside the house, and you will not be able to see other people and able to spread the disease. Now, what happened? That was what happened in the first wave. Most of the people who were affected were the people from the above the age group of 65. Now, later, asymptomatic people and the people who were the carriers, or majority of them were the younger age group there, where their seroprevalence was low. So those people, when they carry the infection, as they travel a lot, travel for the job, travel for the minor work, like they may be the laborers, they may be the agricultural worker, they may be the shopkeepers. So they are traveling a lot. During that travel, they communicate with that counterpart, with the same age group people. And that is why we are getting the spread is more on this age group. Otherwise, I mean, the predilection is nothing much. That is, the virus cannot choose and which age group. The environmental factor and the co-host or the co-morbid features, that is only spreading the disease more among the younger age group. Now, what will happen to the third wave? Now, almost majority of the people in the younger age group, I think 25 to 45, either they would have been infected or they would have got the vaccination. But the children below the age of 18 or children below the age of 20 would not have got the vaccination, or they could have been living inside the house. They would not have exposed to the natural infection. So they are the less seroprevalence, seronegative people. So when the third wave comes, those are the people who are already not exposed to the virus will be the first kind of people to be infected. That is why that age group comes in from each successive waves. The age group infection also comes down. But otherwise, it is not the particular feature of the virus. It is a particular nature of the host. If you are not exposed, your antibodies are not formed, you are more prone to get the infection in the successive waves which is coming.
Absolutely. And on that note, I'd like to add that the only way we can get out of this is by vaccinating the entire population. But do you think the vaccination is going on at the right speed, scale, and time, and how we could better this, sir? What are your views?
No, I mean, obviously, we are not what we expected or what is anticipated, we are not able to get achieved. We thought by this time we would have reached at least 30 crores people will be vaccinated, but we could see only 13 to 14 crores is vaccinated for the first, and totally it is less than what we targeted. There are many factors were there, many reasons for that. But now we are realizing the importance that vaccination is the only tool. So we are trying our level best to get vaccinated. There are various options the government of India is trying. Now that has coming out with that at least by July, August, 10 vaccines will be available. That is what the Nidhi Aayog, Dr. V.K. Paul was saying. And that is a good news for us to hear. So more and more vaccines are coming into the country in the open market, or when it is going to spend through the state, and that will be an easy way. And yesterday, there's a Nagpur court has directed that is a door-to-door vaccination can be done. I fully agree on that, and we welcome that concept, because now at present, people will be a little afraid to come to the hospitals, or big hospitals where there is a lot of COVID positive patients are there. They will always feel they are the red zones for the people spreading for the disease. So they will not like to come for the big hospitals. But if you can take it away from the big hospital setup to the doorstep, either you can have a panchayat union, or a small dispensary, a family doctor clinic, and if that option is given for them to vaccinate these people, and more people will be coming. But only one issue which we are facing is a differential pricing. So what the price at which it is going to be available in the open market is going to be a big question. So it is our humble appeal. We are insisting upon the government that everyone in the country, irrespective of the age group, must have the access to the vaccine at an affordable price. The price which is quoted by the government, by the Serum Institute, is 150, but today the Sputnik has quoted as 925. The Covaxin for the private is 1,250. So such a difference in the price will always will not augment the participation of the people. If the vaccine can be available at a doorstep, free of cost, I'm sure that a lot of people will be coming in. IMA, Indian Medical Association, we have also taken the project of vaccinating at least 1 million people free of cost, and the various other agencies are willing to do that. So government should cooperate and coordinate and take all these stakeholders and ensure that we will be able to do this mass vaccination at least before this September, October area, and when we are expecting the third wave, and we should complete the target of at least 60 to 70 crores people shall get vaccinated by that time.
Yes, sir. And doctor, one more concern is that if we can get the young parents vaccinated, probably the little children would be saved. And when do you think the vaccine for 2 to 12 years would be seen in India, according to your information?
It is a good question. Absolutely. I'm very, very fascinated about that. I mean, I'm so thankful to the government of India for giving the permission for the Covaxin to be get a trial in India for the 2 to 12 years, 18 years of age. It has already, they have on the verge of starting it. The phase 1 and phase 2 trial will be done. We know for sure, and it is going to be effective because it is only a live inactivated vaccine. We are using polio, already we are using many other vaccines. So the complications are not going to be there. The UK study has proved that vaccination is safe. US has already started on that. So we have no issue. So this trial will be over very quickly. I think 2 to 3 months it will take if the government can expedite the process. By at least by August or July, and we will get the clearance that younger age group people will be also vaccinated. So that is one positive feature we will get to vaccinate. As you have rightly said, the parents, if they are vaccinated full, and also the children, if can start the vaccination at least late by August, and we will have some leverage when the third wave is going to hit us. That is a very good positive thing. All of us should work together to see to that not only the vaccine trial is over, but vaccine production is also enhanced. We have a lot of indigenous mechanisms where which this Covaxin can be produced. Covaxin is our India's pride. It is Indian scientists who has made it. So we should share it with all the people who can produce the vaccine, so that the mass production should be enhanced in our country. So we will be very happy to see that more and more Covaxins are produced in our country and made available for our people to use.
As you rightly said, if the price of Sputnik is 900 odd rupees and there are 4 members in the family, it becomes highly unaffordable for everybody to take it. And maybe this may be repeated every 6 months. So you've spoken many times about the personnel and shortage of medical staff, and losing a lot of them in challenges like COVID and death, and so many of your medical people have died. As the president of the IMA, how do you look at this challenge, and what do you feel paramedics be able to?
As on today, our doctor community in the second wave, 210 people have died. and many of them from the younger age group, including the people who are young house surgeons, people who are junior doctor, postgraduates had died. The reason is they are exposed to the viral load in a maximum level. Once they are seeing the patient, 100 people with a positive witness, they are getting exposed to the vaccine, so they are getting died. But and also the people who are working in the hospitals are really stretched out. The way time duration they have to work, the amount of agony they face, the amount of mental stress they face when they are seeing that somebody is dying in front of their eyes, and when the people are in need, asking for a bed, when they are not able to provide a place in an ICU, that all hurts the mental power of a doctor also. So there, a lot of our doctors are mentally break down, and they are really feeling burnt out at this moment, and we need to do something good to augment this manpower. There are various means and ways which we have already discussed with the government. I share with the Honorable Prime Minister from Ministry. I would like to stress on that there is quite a lot of people, junior doctors, more than 1.78 lakhs doctors who applied for the NEET PG exams are still waiting in the country for appearing for the NEET PG exam and enter into that service. And we have citing always COVID as the reason for not conducting. But we must realize that we are conducting this examination only to adopt or induct these people for facing the COVID. So when you are writing conducting an exam to induct people to face COVID, and you cannot cite COVID as a reason to not conducting the exam. It is we have enough infrastructure. There are so many medical colleges, so many institutions where we will be able to conduct these exams at that. Nearby districts at least. If we can do at the earliest, now it has been late. If we can do it at the earliest, and equally all India entrance examination. So these all are the things which will motivate and stimulate young doctors to come and work. When they got a PG, they come with great enthusiasm, great joy to come and work, other than just coming and working for a salary. One thing you must always remember, for a medical community, the degree, the post-graduation course, all these are the most important motivating factor than even the money. So I still appeal on behalf of IMA for the government to conduct the exams as early as possible, give opportunity for the people to come and serve with the enthusiasm and dedication. And this short cap arrangements of 100 days work, all this will be having a lot of difficulty in India to implement. So, that is for the ministry to consider it and adopt it. If we can do that, definitely more than 1 lakh people will be joining the government service, or we will be able to get them for the service of these affected COVID people.
Absolutely, sir. And also, what are the next steps you feel that the government should take as far as even having more task forces, even in states? As you are the president of the IMA, how do you look at this? Because only yesterday I heard a conversation where a lot of doctors were saying that there should be one COVID task force for communication, the other one should be state-wise. What are your views, sir? How we could possibly control the surge?
See, this is COVID is like an emergency situation or warlike situation where we need to forget about all our other small petty egos or issues, and we all should come together as a single unit and work together. Here, there is no question, and who is doing that and who gets the credit is not the issue, but how far we will be able to reach out to our people is the issue. So the single term voice is the most important. If there is a one protocol comes, ivermectin should not be used, and next protocol comes from another sector, there is ivermectin can be used. ICMR is saying that one day, and the second day there is some other statement is coming. That will create a lot of confusion in the minds of the people. So all these issues with related to this technical term or the scientific has to be decided by the learned colleagues who are the technocrats, not only the people who are sitting in the topmost ivory tower institution, the people who are working in the ground level, people who are working in a private sector, people who are working in thousands of people whom they are seeing, must be incorporated as a team, and their views should be taken as what is exactly done by the government of Maharashtra. Then we will have a overwhelming view, that's a 360-degree views of the situation, and we will be able to come out and that. It should be on a war foot. It should not be go to the various ministries to get a clearance, and everything shall be able to put on in a very systematic way by the single minister or a single ministry. Then a lot of things will be happening. At this juncture, we will also stress upon our long pending due. We should have the administrative cadre, the Indian medical service people should be there on the top level, especially the pandemic like this situation, who can understand on the medically and also administrative level. I'm sure that many of our doctors are not good administrators. We can only do technocrat. If they can have a training of an administrative service, and they can be the good combination of the sender to take up and go forward in a difficult situation like this, they will be able to plan. And if I do this, and what is going to happen, what will be the outcome? But that exactly cannot be done by all the just an administrator if they do not have the technological input or the knowledge. So if we want to really make that a separate ministry should be formed at this moment for just taking care of the epidemic, where all the learned colleagues, technocrats, and all sort of people and different representatives of the different ministries should come together. They should given an autonomous power to take decisions, and at a day-to-day basis, they should work forward and motivate, handhold with thousands and millions of people working for the welfare of the people. Take amount the small hospital sweeper, hospital cleaner, the pharmacist, the various manufacturing companies, various industries producing oxygen. All these people has to come together. All of our hands should be held together and go forward. And as a team together, everyone achieve more. And if we can go forward as a team, definitely this we can face this. This is it is an unprecedented challenge we are having. But with a lot of input we have, lot of resource we have, lot of manpower we have, if it is channelized in a proper way, I am confident that definitely we will be able to reach to a very positive state and overcome this pandemic very effectively.
And on that very, very pragmatic note, I'd like to thank you for sparing your time today and joining us for this very interesting conversation. And to all our viewers, mask up India, stay safe, stay protected, and get that jab. And with that, this is a wrap on this edition of FAQ. I thank the viewers for watching, and thank you, sir, once again for your time. Namaste.
Thank you very much, Nidhi, and thank you for the opportunity.